information provided on this site and through this webinar is intended for your general knowledge only. It's not intended or as a substitute for professional medical advice or treatment for specific medical conditions. You should not use this information to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. Please consult your healthcare provider with any questions or concerns you may have regarding your condition. The views expressed here are those of Dr. Richard Horowitz and do not represent the views of Friends Health Connection or the views of the Tick-Borne Disease Working Group, HHS, or the United States. Dr. Richard Horowitz is a board-certified medical doctor specializing in internal medicine. He and his wife, Lee, founded the Hudson Valley Healing Arts Center in Hyde Park, New York, which has treated over 12,000 patients for tick-borne diseases over the past 26 years. Dr. Horowitz is known for his pioneering work with Lyme disease and is recognized to be one of the country's foremost experts on chronic illness. He'll be talking about his new book, How Can I Get Better? An Action Plan for Treating Resistant Lyme and Chronic Disease. Okay. Dr. Richard Horowitz, I want to welcome you and thank you so much for being here.
It's my pleasure.
Can you talk about the number of cases of Lyme disease are rising? Can you talk about that?
Yeah, so when I started practicing medicine about 33 years ago, I moved up to the most Lyme endemic area in the United States, which was the Hudson Valley, and I didn't realize it at the time. We started seeing more and more cases, but for many. So the CDC came out a few years ago and basically said there were approximately 350,000 cases in the United States. There was a 320% increase in the number of counties that have been affected over the last 20 years. And it's primarily from migratory birds that are carrying the ticks from state to state and country to country. So we're seeing a tremendous increase. And the problem is that approximately 5% of the US population has been diagnosed with chronic fatigue syndrome and fibromyalgia, which means that, that's over 18 million Americans, and there's no test for chronic fatigue, or sometimes called myalgic encephalomyelitis. It's a clinical diagnosis where you're tired and you have aches and pains, headaches, sleep disorders, memory problems, even dysautonomia with low blood pressure. So I think many of these people probably do have tick-borne disease, along with other inflammatory conditions that we'll talk about in a bit. But the number of cases per year is really an estimate. I mean, from my perspective, we easily could have over 1 million Americans per year who are infected, not just with Lyme, but with other Borrelia species. There are many other cousins of Lyme disease. Every 2 years, they discover a new Borrelia species. In the last few months, they discovered Borrelia lanei, named after Bob Lane in California, similar to Borrelia basseti, which is on the Pacific coast. So a lot of these Borrelia species are not picked up on standard testing. So when you consider that, and you consider all the co-infections like Babesia, Bartonella, Ehrlichia, Anaplasma, Rocky Mountain spotted fever, Q fever, tularemia, we have all of these different co-infections that are now getting into people, making them sick. So I think it's probably a conservative estimate to say we're looking at least 1 million cases per year. And when I was with the Chinese government years ago, they told me privately that 6% of the Chinese population had Lyme. If you figure out those numbers, that's 1.4 billion. That's a lot of people with Lyme on the other side of the planet. So this really is a worldwide epidemic.
Could you talk about co-infections in ticks?
So the co-infections are quite important. What they've discovered in the last few decades is that the number of co-infections in the ticks keeps increasing. So for example, in our area, I was the first doctor to diagnose Babesia, which is a malaria-like parasite. And I diagnosed it in a woman who was in a wheelchair for 5 years, unable to walk. She had chronic Lyme, but she also had drenching sweats in her 30s, which is a classic symptom of Babesia. And once I treated her for Babesia, she walked out of the wheelchair for the first time in 5 years. Well, we'd sent out the ticks for Babesia, and we found only a few percent had it about 20 years ago. Now, over 40% of the ticks in our area in Dutchess County have Babesia. Similarly, we've seen rates of Ehrlichia and Anaplasma rising. We've seen Borrelia miyamotoi, which is a relapsing fever cousin of Lyme. That's now present in 10 to 20% of the ticks across the US. The Powassan virus was in 1 to 2% of the ticks several years ago. Now it's 5 to 6%. So all these co-infections are starting to rapidly rise. And there was a paper done by a researcher in France where they used what's called next generation sequencing, and they looked in the ticks to see what kind of co-infections did they have. And they found 36 different pathogens. And one of them was Lyme, but there were other Borrelia species. There were 10 different forms of Babesia, sometimes called pyroplasms. There was Bartonella, there was Rickettsia. So people have to be very careful because when they remain ill, it's very likely at this point in time, you don't just have Lyme. A lot of my patients have Lyme, Babesia, Bartonella. And once we treat those co-infections, the people do much better. They find a lot of their resistant symptoms improve.
Could you talk about the risk in pregnancy, child, and the blood supply?
So this is a big problem. We now know that some of these infections can be transmitted from a mother to a fetus. So we know that this can happen for Lyme. They've shown it for relapsing fever Borrelia, like Borrelia miyamotoi. We know that it can be transmitted also with Babesia, which is a parasite. In fact, I had a woman, I'll probably be writing up this case presentation early this year. She came down with Babesia years ago and got pregnant, and she relapsed twice with the Babesia in her 3rd trimester of pregnancy, where she developed drenching sweats. And we did a very specific test for Babesia called the Babesia FISH test. It stands for fluorescent in situ hybridization. It's an RNA test. It was positive. We treated her with clindamycin, Mepron, and Zithromax during her 3rd trimester of pregnancy. And both babies, this was 2 consecutive pregnancies, the babies were healthy because the babies could die from hemolytic anemia, from the red cells bursting apart when the babies are born. It's the same problem with Bartonella. They've shown that there are Bartonella species that can be transmitted from a mother to child, causing miscarriages. And the relapsing fever Borrelia also can cause problems in the mother with strokes, disseminated intravascular coagulation where they bleed out from hemorrhages. There's a lot of unusual manifestations that can happen from these different tick-borne diseases. So we have to be careful because Lyme, relapsing fever Borrelia, Babesia, Bartonella, some of the rickettsial infections, these can be transmitted to the fetus. And we now know that Babesia is in the blood supply. A study that was done several years ago showed that 4 out of 1,000 blood transfusions in the United States were tainted with Babesia. So if you don't get Red Cross screened blood, you're putting yourself at risk if you get a transfusion in the hospital. Anaplasma has been discovered in the blood supply. And even this, again, this relapsing fever now has been shown that it can be transmitted by blood. So there's no evidence for Lyme, but Babesia, Anaplasma, Bartonella, relapsing fever Borrelia, these can all be transmitted in the blood supply. And some of the tick-borne infections like Powassan virus, they've now discovered that some of these viruses like West Nile and Powassan are also now able to get to the fetus just like a Zika virus. So we're looking at tick-borne viral infections affecting the fetus, parasites like Babesia, different types of bacteria. We need to be very, very careful. And I'm co-chairing the co-infection committee for the tick-borne disease working group. And one of the reasons I chose it is because we see these co-infections playing a huge role in keeping people sick. And I'm very concerned about pregnant women passing it on to their children for the future generations. I'm concerned about the safety of the blood supply. So we are definitely going to be looking at our committee at different ways of diagnosing these, improving the diagnostics, and improving prevention.
Okay, we have a bunch of questions that came in. With regard to this topic from Robin, how do you know when it's safe to stop treatment? And also, how do you know if it's safe to try to get pregnant after treatment?
So I've treated at this point over 100 women who have Lyme disease. And we put them on a cephalosporin like Ceftin. Ceftin, the generic is cefuroxymaxatil. It is completely safe in pregnancy. So the way that you know if you're active is, and people should take a look at the paper that I published with Dr. Freeman, Phyllis Freeman, and Dr. Mariella Cetera called Validation of the Horowitz Multisystemic Infectious Disease Questionnaire, or HMQ for short. This is a questionnaire that we validated in approximately 1,600 people. And if you're active with Lyme, you should be scoring high on the questionnaire. A score of 63 or higher tells you if you have active disease. And one of the ways of knowing is you have good and bad days where the symptoms come and go. If you're a woman, you'll notice the symptoms will come out around your menstrual cycle. We know that when the estradiol drops off, the symptoms come out. If you take an antibiotic for an unrelated infection, like an upper respiratory infection, you might find you feel better or worse if your Lyme is active. If it's worse, that would be consistent with a Herxheimer reaction, where you're killing off the spirochetes. And you look for migratory pain. One of the hallmarks we discovered in this paper is that the joint pain, the muscle pain, and the nerve pain, the tingling, numbness, burning, stabbing sensations, it tends to migrate around the body in Lyme. And there are only several other diseases where this happens. So if you want to know if you're active, take the HMQ, the Horowitz MSIDS questionnaire, see where you score, see if you have migratory symptoms. You can take a look at a Western blot through a reliable lab like IGeneX that doesn't use just one strain of Borrelia, but two strains like the 297 and B31, and look at the Western blot Borrelia-specific bands. See if you have new bands that have shown up on the Western blot. The Borrelia-specific bands you're looking at are the 23, the outer surface protein C, the 31, the outer surface protein A, the 34, the outer surface protein B, the 39, and the 8393. So if you have a prior Western blot and you repeat it, and you see new Borrelia-specific bands showing up, you know that your immune system is therefore recognizing the bacteria. And again, you can look at the constellation of symptoms, having ruled out other diseases, to see if you're active. But I do put women on Ceftin, cefuroxime, Maxitil during their pregnancy. The babies have all been healthy. I had, again, a woman who relapsed twice with Babesia, but we treated her in the third trimester. And clindamycin is safe in pregnancy, and there were no problems. So, I believe that it is safe for most women to have babies as long as they stay on Ceftin. The problem with using a drug like Zithromax is it's good for the mother, but it doesn't cross the placenta. So therefore, it's not really going to be protective for the fetus. But once you know that your symptoms are better, you don't have the migratory pain, you're feeling better, even if you're not 100%, women can get pregnant and still have healthy outcomes for their babies.
Thank you. There's a ton of questions coming in, so I'm going to pick and choose from these questions and other questions. First of all, what is your opinion? Now, again, this is Dr. Horowitz's opinion. You should always check with your own healthcare professional, but what is your opinion on long-term antibiotic treatment compared to herbal?
So it depends. Every person that I treat is completely different. If you have a mild case of Lyme disease and you don't happen to have a lot of co-infections, and let's say you don't have a lot of autoimmune overlap, you don't have a lot of heavy metals and mold toxins, you're getting to sleep, the autonomic nervous system, the part of your nervous system that controls your blood pressure, is working fine. If you don't have multiple overlapping problems on what I call the MSIDS map, multiple systemic infectious disease syndrome, which I've discovered there are 16 reasons why people stay sick. So the people that don't have a lot of factors on the MSIDS map, generally, if they've been treated with antibiotics and they have mild symptoms, they can use herbs. You can use Cemento and Banderol from the Cowden protocol, was shown to be 70% effective. And the studies that I did with Nutrimetics, Dr. Eva Shoppe looked under the microscope and also found it killed Borrelia. We've had success using traditional Chinese herbal protocols, Coptis, Hudiana, HH, R5081, Circulation P, Cordyceps, Purarn. There's a lot of Chinese herbs that can be effectively used. Again, probably effective in about 70% of the cases. Some of the Booner protocol using Cemento, Japanese knotweed, Andrographis, again, effective in approximately 2/3 of the patients. And the Byron White protocol is one we use quite frequently. Now, some of the newer herbal protocols, like the Biocidin protocol with oregano oil, the reason we're using these now is because in the last few years, researchers from Johns Hopkins University have shown that Lyme persists in biofilms, and there are what are called persister forms. And Dr. Ying Zhang from Hopkins did a study several months ago where he showed that oregano oil, along with cinnamon and cloves, is effective against some of these persister forms and biofilm forms. Well, similarly, we did a paper approximately 2 years ago on the first persister protocol antibiotic for Lyme, and the drug that I used was called Dapsone. and it's a drug that's been used for other persisters like leprosy. And we've been finding tremendous success in people using this protocol. And we even have a new protocol that we'll be publishing later this year on using dapsone in a much shorter course, 7 to 8 weeks, for people who have been chronically ill. And we are starting to see some success, but I don't have the full results at this point. This is an ongoing study that we're now doing. So again, the herbals can be used for people that are generally well, do not have a lot of overlapping factors on the MSIDS map. But remember, you can mix antibiotics and herbs. If you're someone that has sensitivity in your GI tract and you can't use a lot of antibiotics, you can mix, for example, doxycycline with traditional Chinese herbs, or doxycycline with rifampin, along with Artemisia for babesia, along with Chinese herbs. They mix and match. It's fine to use it. It's very individualized.
Okay. Can you talk about redefining the disease? So you say it's not just chronic Lyme. You've discovered 16 reasons why people remain chronically ill. Can you talk about that?
Sure. So again, I've been doing this for about 3 decades. I've seen at this point over 12 to 13,000 people with the illness. And what I would discover every couple of years seeing patients, the first few years it was babesia, with the woman who walked out of the wheelchair. Several years later, there was a woman who could not speak. She had what was called aphasia. And we looked for every co-infection at the time that we knew about. Well, we didn't know about Bartonella at the time. And she went to Harvard and Mass General, and they said, oh, maybe you have a migraine, and that's why you can't speak. It turned out that after we treated Bartonella with moxifloxacin, Avelox, she spoke for the first time in several years. Then we started discovering heavy metals like mercury and lead getting into people that overlap Lyme symptoms. The heavy metals will cause fatigue and neuropathy, memory, concentration problems. So we discovered heavy metals, and then we started discovering mold toxins like aflatoxins, trichothecenes, gliotoxins, which are immunosuppressive. We would start looking at hormones. We discovered the men who came in who said, I'm very tired with no libido. Many of them had low testosterone because the inflammatory molecules that are produced during an infection with Lyme would shut down the pituitary, the main regulator of your hormones, and they would have no testosterone, or the adrenals were low. Or women would have early menopause because it would be lowering estradiol and progesterone. Or they would develop a Hashimoto's type symptom because Lyme creates autoimmune antibodies with antithyroid and antithyroid globulin antibodies. So we started discovering that it was all of these different factors. People said, hey, doc, I'm tired, I'm dizzy, I can't stand up without passing out with palpitations. Well, that was POTS dysautonomia. The Lyme caused a neuropathy, where it affected the way your blood pressure is in the body with your heart rate. And we found that when we raised the blood pressure and heart rate, many people got better. Lyme patients don't sleep. They have something called delayed sleep phase syndrome. It's a circadian rhythm disorder. If you don't sleep, you have inflammation. And inflammation is the primary reason why people stay sick with Lyme. And I call this the 3 I's. Infections, immune dysfunction, and inflammation is driving all of the symptoms you're seeing with Lyme and co-infections. So when you talk about fatigue and joint and muscle pain and headaches, insomnia, mood swings, memory problems, we now know that these are due to inflammatory cytokines. They're called TNF-alpha, tumor necrosis factor alpha, interleukin-1, IL-6, interferon gamma. These inflammatory molecules are what are responsible for people feeling ill, and they can be caused by Lyme, they can be caused by co-infections, they're caused by not sleeping, they can be caused by environmental toxins with free radical oxidative stress. If you're mineral deficient with zinc, that causes inflammation. You could have the wrong bacteria in your gut where your microbiome has been affected. That's now being linked up to inflammation with Alzheimer's and Parkinson's and cardiovascular disease. So all of these 16 points are necessary to review when you go to your physician, because we find that many of our chronically ill people, they don't have one thing wrong with them. So the way that I redefine Lyme or chronic Lyme is Lyme MSIDS. And the reason is because we don't ever see now at this point just Borrelia burgdorferi that is causing the symptoms. We see co-infections, we see autoimmunity, we see sleep disorders, environmental toxins, detoxification problems, leaky gut, food allergies, hormone disruption, POTS dysautonomia. All of these including mitochondrial dysfunction. The mitochondria are the part of your body that gives you energy, that helps with nerve function, with cardiovascular function. So in that case, these free radicals damage the mitochondria, and you need to also heal the damage to the body. And we find about a third of our patients, when they do mitochondrial regeneration, they get better. So it's very important, and this again is 30 years of working on this disease. It's very important to understand there's a paradigm shift that we now need to do. We learned in medical school, Pasteur's postulate, there's one cause for one disease. In real life medicine, what we're finding is it's multifactorial. So the paradigm shift from my perspective, if we're going to solve chronic disease epidemics that are affecting Americans and are affecting people worldwide, where 5% of the US population has chronic fatigue and fibro, and there's no test for it. It's a clinical diagnosis. We see over 50 million autoimmune diseases in the United States. Well, Lyme and environmental toxins causes autoimmunity. Every 67 seconds, someone gets Alzheimer's in the United States. We're now showing Borrelia burgdorferi in the biofilms of people with Alzheimer's, along with other infections like herpes viruses, CMV, Helicobacter, chlamydia pneumonia, and they're now showing pesticides causing Alzheimer's type plaques with amyloid. So if we're going to tackle all of these different diseases that people are getting, including even cancer, a lot of these environmental toxins are all carcinogenic, apart from genetic factors. I think this multifactorial model is really going to be necessary, and we now know that we're trying to move towards personalized precision medicine. Well, the 16-point MSIDS map is a personalized precision medical model where no two people that come to me have exactly the same, problems and diseases. So it's all completely individualized, but it really makes a huge difference in getting people better.
And that ties in a lot also, I guess, with the difficulty in diagnosing Lyme. I know a lot of people go through difficulty getting a diagnosis. And on the flip side, chronic Lyme has been proven to exist by Johns Hopkins researchers, Tulane researchers, and Northeastern University researchers. Do you want to talk about either of those topics?
Yeah, so the problem with the testing is that what people forget is when the CDC and the health departments had on their websites that you use this two-tiered protocol of an ELISA followed by a Western blot, that was really only to epidemiologically screen large populations of people. It was never meant to be used for an individual diagnosis. And unfortunately, some of the insurance companies have adopted this, and they've used it, and many people, therefore, do not get diagnosed. And there's many papers that have been published in the last few years. The last ones by Cook and Puri that came out basically showed that it's about a coin flip, a little over 50% sensitivity of picking up the disease using an ELISA and a Western blot, and it's much worse, 100-fold worse than trying to test for HIV. So this two-tiered testing basically only works in approximately 50% of the people. And part of the reason is there are all these different strains of Borrelia. We now know that it's not just Borrelia burgdorferi sensu stricto, which is the actual bug that causes Lyme, but there are these other species called sensu latu, which are a whole host of different Borrelia that cause human illness. So it's important to realize that you're not going to pick up all of these species like relapsing fever, Borrelia miyamotoi, which is now showing up in a lot of the ticks. It's showing up in the New England where people didn't know they had it. In San Francisco and California, if you looked in the ticks in the Bay Area, you're going to find exactly the same amounts of Lyme and relapsing fever. And relapsing fever causes Lyme-like illness. So therefore, you could have a negative ELISA and Western blot and still have a Borrelia species along with co-infections. So the first thing that's important to realize is the testing is not reliable. You may need to do a panel of tests, not just an ELISA, but a C6 ELISA. The C6 ELISA also checks for European strains like Borrelia abzelii and guarini. It's a bit more sensitive. You might find it on an immunofluorescent antibody. And then there are other ones like the Lyme.blot, PCRs, cultures. There's ways of direct testing to try and find it. And Johns Hopkins researchers like Dr. Solosky are now looking at chemokines, these inflammatory molecules that are produced early on in the illness, which attract your white cells and lymphocytes to the site of infection. And Johns Hopkins researchers, John Alcott and others, have shown that CCL19, one of the chemokines, is now being found in chronic Lyme. And these chemokines can be found in early Lyme before antibodies are made. Now, this is very important. to do this type of a test because we've had people that have died with Lyme carditis. There was a young man in the Poughkeepsie area who went to his doctor with flu-like symptoms with a sore throat and vomiting and diarrhea. And the doctor said, oh, it's a viral infection. Came back a few days later, said, I still feel sick. They tested him for Lyme with an ELISA, and he died 3 weeks later. And they found that he had Lyme carditis. It had spread throughout his body, and the ELISA was negative. So we have to be very careful with flu-like symptoms in the summertime. And eventually, when this test is validated, they're validating it now through Columbia University called the Spiro test, looking at these inflammatory chemokines. This will be very useful because Lyme is able to be cured at the early stage in the illness. So I think from that perspective, it's important. Now, regarding persistence, there are many studies that have been shown that Lyme persists. There's over 30 of them that I could probably mention to you right now, but the ones that have come out in the last couple of years, which are the most important, is Monica Embers just published a study from Tulane that you mentioned, where she did this and she actually did 2 studies, one by pathology where she proved it and one in the macaque monkeys. And she showed that by pathology, looking under the microscope, by PCR, by culture, by xenodiagnostics, taking uninfected ticks and putting them on monkeys who received antibiotics, that if you just got 30 days of doxycycline, they could show persistence of Borrelia. And that is clearly what we're seeing in our patients all the time. Kim Lewis from Northeastern has shown it. Ying Zhang and others have shown from Johns Hopkins that there are persisters that are now showing up. Eva Shoppe and other researchers are showing that these persisters are living in biofilms. She and Anna McDonald have published on it. So biofilms and persisters are probably some of the most important research that has come out in the last few years, because when we were treating people for Lyme a decade ago, we only knew about 3 forms of Borrelia: cell wall forms that would respond to penicillins and cephalosporins, cystic forms that would respond to plaquenil, grapefruit seed extract, flagyl, tinidazole, and intracellular forms that would respond to doxycycline, macrolides like zithromax, rifampin, or quinolones. But I've expanded the literature in the last few years where now I'm using mycobacterium drugs like dapsone and pyrazinamide that I published on, and we're finding a lot of the people that fail traditional therapies are doing very well with these persister drugs used for other persistent organisms like tuberculosis and leprosy. And when we combine biofilm busters, stevia, oregano oil, biocidin, lauricidin, many of these have been published in the scientific literature to help open up the biofilms, and we are seeing that these are definitely playing a role in some of our chronically ill people. So this is giving hope to people that have suffered for a long time. So if you're sick and you have not gotten better, you've got to go back to the 16-point MSIDS model to see what might not have been tested for, and you have to make sure that you've treated all the different forms of Borrelia, plus the biofilms and persisters. And again, we will be publishing some studies later this year on further studies showing the efficacy of dapsone and pyrazinamide. So we're very excited about this research because we are finding some really remarkable results in people that have failed traditional therapies.
To that end, what could people do that's within their control, such as diet and exercise, positive thinking, anything, meditation? Have you found anything that you believe helps improve quality of life and helps improve the level of pain, helps improve people in general, that people could do within their control?
So there's something in my new book, How Can I Get Better? I call it Master the Big 3. Sleep, diet, and exercise. They're absolutely essential because when you don't sleep, as I said earlier, you don't shut down the inflammatory response. Very difficult to get over fatigue and cognitive issues if you're not sleeping. But diet is equally important because if you have leaky gut and multiple food allergies, it causes the exact same inflammatory cytokine production that you get with Lyme. So I'll give you a great example. We had a guy, in fact, he just came in yesterday to my office, and he's in my book. I call him Brad had Lyme disease, rheumatoid arthritis, and Bagel's disease. And what this was is Brad had true rheumatoid arthritis. He was CCP positive, the marker for rheumatoid, but he had migratory joint pain, not just symmetric joint pain in his hands and knees from the rheumatoid, but migratory, which is the hallmark of Lyme. He had drenching night sweats, and I said to him, well, I don't think you have menopause. I think you have babesia, which he did test positive for. And then every Sunday, he would eat bagels, lox, and cream cheese, and his knees would swell up to 2 to 3 times the size. He didn't realize he was gluten sensitive. So when we treated his Lyme, we treated his babesia, and we got him off gluten and allergic foods. Then when we treated his rheumatoid arthritis, his methotrexate and the drugs that he previously failed worked perfectly. So diet is very important because we find a lot of people that have multiple food allergies. You can get histamine release with something called mast cell activation disorder or mastocytosis. You see a fair number of people with mast cell, which is also associated with POTS dysautonomia. So if you're someone with resistant migraines, resistant nausea and vomiting, fatigue and pain, and you're itching a lot, especially after foods, or you have asthma, allergies, allergic rhinitis, those are classical symptoms of histamine release. I don't need my asthma spray anymore as long as I avoid my histamine releasing foods. I am histamine sensitive, as are many people that I see. So food, getting on a proper diet, doing a trial off gluten, wheat, corn, soy, dairy, nuts, the common allergens, very important, while doing a CDSA, a comprehensive digestive stool analysis, to look at what is going on in the gut. Do you have enzyme deficiencies? Do you have problems with the microbiome? Do you have parasites, the wrong type of bacteria? It's very important to heal the gut, looking for leaky gut. There's a marker called zonulin that you can use while looking at histamine. And we find that when people are on a proper diet and they're exercising, because exercise helps your mitochondrial regeneration, it obviously helps with fatigue and sleep. So when you're exercising, you're doing diet, and you're meditating, it turns out that meditation, when JAMA looked at all the articles, over 18,000 articles on meditation, they found that it actually improved pain, it improved mood, and it lowered the same inflammatory molecules that we see with Lyme. And many of the Lyme patients come to me very anxious. When will I get better? I feel there's no hope. How do I know I'm going to get over this? To meditate or do biofeedback is very important for these patients, because the mind-body connection with psychoneuroimmunology, how your immune functions with the mind-body connection, is extremely powerful. So getting on a proper diet, exercising, getting to sleep, meditating, absolutely crucial as part of a healing program. And we do see that it makes a huge difference in keeping people well and getting better while we're treating their infections.
I'm going to thank you very much. I'm going to stop for a second, ask you to hold up your new book, which is available everywhere bookstores are sold. And it's called How Can I Get Better? An Action Plan for Treating Resistant Lyme and Chronic Disease. So you can look for that wherever books are sold to get more information. And I'm going to just ask a few brief specific questions from you, but Dr. Horowitz, where could people get more information about your center and the research that you're involved with? Are there specific websites people could go to? And if what people want to contact you, I know there's a long waiting list, or I believe there's a long waiting list to see you, but how could people get in touch with you? How could people get more information?
So I do have a Facebook site, Dr. Richard Horowitz. And I post on Facebook reasonably regularly when new articles come out that are important. People have contacted me on there. I don't always get a chance to go on and answer all the questions just because I'm so busy, especially now working on the HHS tick-borne committee. But I do occasionally answer questions on the Facebook site. The Can Get Better, I have a website, cangetbetter.com. We definitely need to kind of get the website up to date with some of the new research. It's been difficult keeping up with all of it. But I think probably the best way to contact me is probably through the Facebook site at this point in time. The office email is medical@hvhac.com. Now, the thing about that is I cannot answer individual questions for patients when I'm not your physician, right? And general information, is generally in my book, and that's what I'm going to quote to most people based on the scientific literature. But for people also that have questions about where can I find doctors, right? There are sites also like the Lyme Disease Association.org, LDA.org, ILADS.org, the International Lyme and Associated Diseases Society. Those are also good sites. There's a lot of information on the LDA.org and ILEDS.org websites. You can find physicians. And just so people know, I'm in the process of interviewing a physician who's high on the list that we're looking to possibly bring on in the very near future. I'm also interviewing PAs and nurse practitioners to expand the practice. And if people do have an interest in coming into our practice, you should contact Janet Kosh. The email is Janet, J-A-N-E-T-C, Janet C at hvhac.com, Hudson Valley Healing Arts Center.com. We will be opening up the waiting list probably shortly once I find a doctor and or a nurse practitioner PA to join, because we have had hundreds of people on a waiting list. They won't be seeing me directly, but they can see John Fallon, my nurse practitioner, the new doctor, and I always come in on the visits. I'm training the doctors and all of the providers in my practice. So that's really the best way to get in touch with us.
Thank you. And on our end at Friends Health Connection, again, we're looking to start online support groups where you could come on screen and talk to one another. And we're going to be opening most likely an online community where you could find friends who've been through not only the same diagnosis, but also the same symptoms that you're going through. And if there's other experts you want to talk to, you could email us at admin, ADMIN, at friendshealthconnection.org. Dr. Horowitz, two more quick questions. So we're not going to ask you, there's a lot of people who are asking questions specific to their case. I'm going to avoid those and just ask one or two interesting questions here. Is there a difference between treating Lyme and co-infections from Europe versus North America?
So there are different co-infections in different Borrelia species. Like in Europe, they have mainly Borrelia avzelli, which causes a rash called acrodermatitis chronicum atropicans. It's a violaceous skin rash of the hand. That's a bit different than the EM rash we see here. They have Borrelia guarini, which causes neuroborreliosis. But they also have other Borrelia species like Valsana, Lusitania, Bavarensis. They have a whole bunch of other Borrelia species that we generally don't see here, although the migratory birds that are going over the US and Canada, they have found some of these species sometimes in them. Similarly, for the co-infections, when you look at the Babesia species in Europe, there's Babesia venatorium, EU1. They have other species of pyroplasms of Theileria. So there are differences that you will see between Europe and the United States. And hopefully the testing in the next couple of years, both through PCR, RNA, next generation sequencing, we hopefully will be able to identify in people that are chronically ill, what are your co-infections? And we are finding, and I've been looking at the questions that people are asking. We won't have time for all of it, and people should know a lot of the questions I'm seeing on the chat box, they are answered in my book, like on low-dose naltrexone, on treating other parasitic infections, because we do see parasites overlapping with Babesia, about the endocrine system, of how the inflammatory cytokines shut down your pituitary gland. So a lot of the questions I do see in the chat box, please know it is in the new book, How Can I Get Better? And in the addendum of the back of the book, in the appendix, I have the dosages of the medications, all of the different functional integrative techniques that I use that also help people that have been validated. They're also with dosages in the back of the book. So a lot of your questions can be found there.
Okay, and one other thing I wanted to mention is when you said Hudson Valley, your practice is based in New York. For those of you who are asking, it's based in New York. There's one specific question I'm going to ask, if you can't answer it, or if you don't want to answer it, it's fine. It says, we have been told my son has NDPH 3 years only to find out he has Lyme. Could Lyme cause NDPH? We are now treating for Lyme. Could the level 8 24/7 headache go away?
I'm going to need a definition of NDPH. Are you talking something like Pans Pandus?
This is for Kim on the line.
Kim would need to, because it's not an acronym that I'm used to hearing.
Clarify that. Okay. I think we're going to end here. Are there any final thoughts or any final comments you'd like to add or say? And if you want to lift up your book one more time, just so people could see it, your new book. You do have a previous book too, but this is a new one. How Can I Get Better? An action plan for treating resistant Lyme and chronic disease. Right. So any final comments?
Yeah, so NDPH, I got it. It's new daily persistent headache. It's a primary headache syndrome that mimics migraines. So the problem I face with headaches, and you really should look up the neurology chapter in my book. We are finding that a lot of the resistant migraines, if you go into three main sources: hypoglycemia with blood sugar swings, food allergies, looking at IgG, delayed hypersensitivity, and IgE, looking at histamine sensitivity, which causes a massive amount of migraines in the patients who come to see me, along with lack of sleep and stress. Those factors that I just mentioned are the biggest factors that we're seeing, apart from women, for example, that have hormonal menstrual cycles. You know, they go on the birth control pill because the estradiol will sometimes cause problems with it. But those factors with headaches, I have never had to use that acronym. In 33 years of practicing medicine, what I try and do with the MSIDS model is you don't label a disease and just throw a name at it. You try and figure out the multifactorial causality. And again, with headaches, sleep, stress, leaky gut with food allergies, histamine, mast cell, hypoglycemia. These are really common factors we see that cause daily persistent headaches or very severe intermittent headaches in our patient population. And for the people that were asking about LDN, LDN definitely helps lower neuroinflammation. It affects cells in the brain called microglial cells that shuts down inflammation in the brain. It's something actually I take even myself in the morning because of the beneficial effects. You can do neurofeedback and things like that for headaches and for migraines, very, very useful. So I think, again, if you go through my new book in detail, and my first book, for those who want more of the biochemistry, the first book, which is Why Can't I Get Better? Solving the Mystery of Lyme and Chronic Disease. There's many more patient stories. We couldn't all fit them in the second copy. But for those who are interested in the biochemistry and a lot of the really deep science of what goes on at the cellular level, that book has a lot of that information in it also for people who want to upgrade their knowledge base.
Thank you. Thank you to Dr. Horowitz. Thank you for everyone who participated. Again, for your own case, please check with your own physicians. And we hope to see you back here. Any comments, questions, or suggestions, you could email us at admin@friendshealthconnection.org. Dr. Horowitz, thank you for all of your work. Thank you for your book and for being here today. We really, really appreciate it.
It's my pleasure. And please, I want to send blessings to everyone out there. Just remember, never give up. You have to have hope. I'm finding answers. A lot of them are in the new book. There will be new publications coming out. So please, everyone, have hope and just hang in there, because we are working at this level, at the federal level. We have an amazing group of people that have come together to solve this epidemic. So please be patient. We're all working on your behalf, and I send you all blessings.
Thank you. I do too. And blessings to you, Dr. Horowitz. Thank you.
Have a great day.